Hi, my name is Yumika Cogwell, and I will be discussing a peer-reviewed article entitled Evaluating the Equivalence of or Difference Between Psychological Treatments, an exploration of recent intervention studies, retrieved from the Canadian Journal of Behavioral Science. The article was published in 2013 and aimed to examine 10 years of psychological literature between the years of 2000 and 2010, and provided a description of how significance testing statistics have been used in behavioral science cases where researchers compared two or more treatments. The researchers concluded the research based on questions of quantity and quality. The study focused on what was occurring in the research field when researchers applied the most controversial and most used method, which was called statistical tests of significance. The overall goal or objective was to determine whether the difference across treatment conditions were significant, and research aimed to determine if treatments of interest were equivalent. The peer-reviewed article expressed what difference tests could and could not do, as well as equivalence tests and what they could and could not do as well. The purpose as it pertains to two comparison treatments is that the question of whether the two comparison treatments are so the same that a doctor could recommend shorter times, less cost, or less invasive treatment to a client, or tell the client to get the same beneficial result in a lengthier, more costly, and more invasive treatment, are formed with the difference test and later answered within the results. Difference tests can only provide yes or no answers to questions, whereas equivalent tests answer questions with binary numbers based on data. Difference tests are possibly used to determine the effectiveness of a treatment as usual, or TAU. An example of using TAU is when TAU for depression was given to a group as a type of SSRI, or selective serotonin reuptake inhibitor. An instance of when an equivalence test is used or considered a useful tool is when 2 administration periods of psychotherapy was evaluated for cost effectiveness and efficacy, and 12 weeks of therapy was compared with 8 and 10-week programs to see the amount of benefits that could be attained in the shortest amount of time. The study compared treatments for diagnosable behavioral conditions such as anxiety, depression, phobias, or compared 2 or more treatments for measurable psychological factors such as interventions that improved one's perceived quality of life. Meta-analysis criterion was excluded to prevent redundant data. Of 270 peer-reviewed psychological comparisons, 139 were therapy studies that examined treatments such as therapy versus therapy, drug versus drug, therapy versus placebo, and drug versus psychotherapy. An average of 24.5 studies per year were collected. Statistical tests were used in each study to categorize difference tests and or equivalence tests based on null hypothesis, and the study did not state the use of the significance test or provide any results of any mathematical comparisons that could be categorized. The hypothesis was intended to be either directional or non-directional. The result of this evaluation was that 147 people, or 54.4%, stated conclusions of equivalence. In 2 studies, equivalence tests were used to conclude difference between treatments. Both difference and equivalence tests are used as primary outcome variables, but the study found no significant difference and ultimately concluded that difference tests were the chosen tests because there was no equivalence, and there was a difference between the treatments that the difference test did not succeed in detecting. All of the studies opted to use significance testing, and within significant testing, equivalence tests were not selected. All in all, exploring research questions with yes or no answers versus binary numbers give researchers and researchees a better evaluation of excellent choices in psychological treatments. And that is my peer-reviewed article. Thank you. Have a nice day.